specific. What is your favorite technology for skin tightening and or body contouring, and the least favorite? So we want to really leave a message here for the group. Okay, Jason, go ahead.
I think my patients really respond the most to Venus Legacy. I don't think that a single treatment, it gives a significant result, but I think over time, in combination with other things that you do, patients seem to be pretty happy with the results from it, especially since it can treat a lot of other areas like elbows, knees, face pretty well. It has very little risk.
So are you talking about skin tightening or body contouring?
Yeah,
it sounds
skin-
like since you
skin
said face,
tightening.
it sounds like you're talking about skin tightening.
Yeah, tightening.
So you would take Venus, you say Freeze or Legacy?
Well, the Legacy, since it has all the components, there's
So you take the Venus over, say, Thermage, Exless Elite, Ultherapy, and so forth.
I mean, that's what's hard is that a lot of times I'll do one of those, like Thermage, for example, will give you a much larger single time enhancement so that you're doing a one-time treatment for a couple years of a result, but then you can maintain with something like a Venus Legacy since it's less energy sort of cumulative over time. So it's hard to pick one, but I find that in terms of what the patients are saying to me, they see instant results, I think, with the Legacy, and they feel a little bit lifted, even those results might not maintain for a long period of time.
Barry?
Okay, thank you, Barry.
Can you be more specific?
Yes, now I can. I think the question, like some things are good for both fat and skin, and some for skin only. So, for example, let's work with the face, the neck. If I want to do fat and skin, the number one I would go to would be the Precision TX side-firing 1440 laser. For fat and skin, if someone has skin only, although I could use that, I think lately we've been doing more work with the Thermi-Tight at 65 degrees for skin tightening, although that could do.
Hey, Barry,
So,
Barry, slow down.
Hello?
Slow down. We want to play a little bit here now. Slow down.
What do you want to do?
All right. So listen, you're talking about precision. So why don't you break this down like we did in the talk? So you're going to talk about inside procedures or minimally invasive procedures. So list the ones that you do that are minimally invasive, because it's going to get real confusing if you start talking about precision and Jason's talking about Venus. Because I think they're apples and oranges. So
In fact, why don't we just keep it as non-invasive for now?
Yeah.
What do you say, Renato?
Yeah, good.
So let's no breaks in the skin, okay? Barry,
I'm
answer.
already confused.
Let's do non-invasive.
That wouldn't be my go. I don't think I get very good results with non-invasive for skin tightening and fat.
well, are you talking body or face?
Face, I'm starting with face.
What about Ulthera?
I use it. I think I can get better things going minimally invasive.
But the patient doesn't want to be cut. No
Let's say,
cut. No
we'll,
cut.
we'll give you minimally in a minute, Barry, but if non-invasive, which do you prefer? Let's take
What?
Ultherapy or Thermage.
Oh, definitely L-therapy. I don't have Thermage. For
okay,
other
well, that's not
reasons,
fair
but
then.
I've used both.
I really only have one thing
I
to
have
use for
both.
non-invasive.
I've used both and had both. I use Thermage mainly now over Ultherapy for a couple reasons. I find that the patients have a little bit less pain, and then I can be more specific for determining my long-term results from it. I definitely think it's a little bit more expensive over time, especially if you do a lot more lines. With the Ultherapy and certain transducers, it just costs a little bit more. And the pain aspect to it, I think, was just a deterrent for me. I get good combination results with that and using something like Sculptra for skin tightening in combination. So chest, elbows, arms, face. So, and I typically pick that, but I also think that either one of them is dependent upon who's doing the treatment. So with Thermage, obviously you're looking for certain temperature over time, and then with Ultherapy you're looking at lines and you're being specific to where you're activating the device. So I think you can get good results with both. It's just really who's doing it.
Okay, let's rephrase it. What is your favorite technology for skin tightening? Facial.
Non-invasive.
Let's try again. And Andrew.
Hands down, Cyton Halo. That's the only device that's ever actually given me results better than what I had
Come on,
expected.
and
Wait
come
a
on.
minute. Wait a minute. We're not talking about color. We're
Come
talking
on,
tightening.
We did wait. Come on, we did the development of that device. Okay,
Halo's
started
great, but
in
it's
our
not for
office.
tightening,
We love
it's for
Halo.
color.
No
I
tightening.
should have brought my computer. My nurse just sent me a picture today of a lady's knees that she treated with Halo, and the skin tightening was unbelievable. And I'm just telling you, we just started doing off-face stuff with Halo, and it's
How
Cyton
deep are you
Halo.
going?
That-
How deep
Michael?
are you going?
we did peri-umbilical too.
How deep are you going with that?
400, 20% density.
Any erbium with that or no?
Yeah, like a 20 micron.
So what he's
erbium.
talking about is a new Cyton hybrid laser that's a fractional ablative and non-ablative in the same hole. Really cool device. It's mainly used for texture, pores, and some pigment on the face. That's its general use, and that's what we all know it for. So if he's now talking about an off-face thing for it, that's pretty cool. We'd love to try it. But
You asked
Mike,
and
how about
you asked
Michael?
me,
Are
I
you-
gave you my answer. I can't.
I'm going to look into Halo after that. I love Ulthera on the face. I don't use anything. I try to avoid removing any fat from the face at any time, pretty much. Yeah, that's it.
Corey, non-surgical, non-invasive skin tightening of the face.
Well, and I think, too, when you start throwing in fractional resurfacing with things that are totally non-invasive, like RF and ultrasound, it is that just too becomes a little bit apples and oranges. But if I were picking just skin tightening, I would say laser skin resurfacing, fractional or otherwise, is probably the best thing for just general skin tightening, but it also improves, just like Jason was saying, the contour, the pores, the texture. In terms of improving contour, I would go with Ultherapy on the face, and on the body, we still like VeloShape. I think if it's done right and you apply enough and the patients understand it's a recurring therapy, then it works totally great. So I think that's the important part, is like everything else, is patient education.
Jason Posner, body contouring now?
well, let me just respond to Corey. So kind of let's break this down
can't
again,
harness
because
them.
otherwise we're going to get confusing. Barry, you can yell at me too. I like that. So, Corey mentioned resurfacing.
Oh, wow.
But I don't put resurfacing and skin tightening in the same kind of sentence, because deep resurfacing, I love it. I do it all the time. You got a week downtime. So the patient who's coming to you for skin tightening, in my mind, is a non-surgical, no downtime device. In my mind, on the face, that's Ulthera or the fractional microneedles, which might be a little more aggressive, but I'll consider that maybe a one-day downtime. But that's my no downtime kind of go-tos. I love resurfacing, but if you're gonna cook somebody, they're down for a week to 10 days.
See, and that's why you guys are cooking, they're red
Yeah.
for weeks, and I can't
Right.
put a little thing under the skin with no, I don't understand what's going on the other side there. I don't have a skin breakdown with my little fibers.